Let's look at the other normal phenomena which babies put the parents into dilemma with. So, a baby may choose to pass 20 stools in a day, or on the other hand, may pass 1 stool in 7 days, and believe me, both of this is normal. So when the baby is born, the first 5 days you have a darkish greenish black color stool which is called meconium in medical language, which on the 5th day changes to a yellow color, and on that particular day the child may have many stools, which is called transitional diarrhea, and it should not be treated. Apart from that, there are other phenomena which are normal about newborns. Say for instance vomiting. Even after feeding, if you put the baby on the chest and burp the baby might still decide to throw up a little curdled milk, the whole feed, or just a small burp with a small amount of milk. This is a normal phenomena and it does not require treatment. The only time that we need to treat vomiting in a baby is when the vomiting is so excessive that it prevents weight gain for the baby. Hiccups, noisy breathing are again a normal phenomena. Occasional sneeze, occasional cough is again normal and does not signify an infection, therefore does not need to be treated. Babies may also make funny noises when they are asleep, but again that's again normal because their airways are soft and narrow and therefore does not need to be treated. There are a few other normal phenomena like hiccups. Hiccups is again not to be given too much weightage, or one should not worry about it, and it stops on its own. If at times it's troubling the baby, a little more feeding, that is breastfeeding, would take care of the hiccups. Just like hiccups, stretching is also a normal phenomena. Consider yourself in a position of the baby who sleeps for about 18 to 20 hours in a day. Obviously, even if you were to sleep so much, you would get up stretching. So stretching is just a normal way for the baby to exercise and stretch his muscle. Similarly, crying is a normal phenomena. Many a times, apart from crying for hunger, or if the baby is wet, or the baby wants to be carried, or of course any discomfort like a colic, etc., babies may cry just to spend their energy, and then they could build up a hunger and then take a next feed. It is said that on an average, a normal newborn can cry up to 3 hours per day. So hold on, parents, be there for the baby even if the baby wants to cry for 3 hours without any worry and concern. Now, what is the best way to feed the baby? The best way, of course, is breast milk. All babies who are breastfed are healthy babies, and stay away from doctors for sure. Demand feeds should be given to the baby, and that means whenever the baby wakes up and cries for a feed, one should feed the baby, and it could be as frequently as 2 to 4 hourly. My colleague Dr. Shabnam would talk to you in details about the advantages of breastfeeding. Breastfeeding should be done on alternate breasts. It is best for you to feed on one breast for about 20 to 30 minutes, and for the next feed, feed on the other breast. Burp the baby after feed. For the first 3 to 5 months of life, babies do not have a day or night rhythm. The only thing which wakes them up is hunger, and therefore you need to feed them both in the day and the night as and when they get up for a feed. Believe me, after 5 months, things will be much simpler and you would get your night's sleep when the baby gets the day and night rhythm. What else should be done for newborn babies? Here I would like to bring to your notice about 2 tests which are now recommended universally. One is the newborn hearing screen, which is done for all babies and internationally, and it has come even into our country, and it is a good idea to screen the babies for a hearing problem. Early screening is recommended to detect infants with hearing loss, and an early detection could help in some action which could help the baby. There are few tests which are done, which are blood tests, which are done to screen for metabolic diseases, and these diseases are crippling diseases which cause mental retardation, or it really affects the baby very adversely. So screening for diseases at birth is now universally recommended. What else should you know about your baby? So the first thing I would like to tell you is all babies lose weight after birth, and they regain their birth weight somewhere around the 10th day. So initial weight loss is not too much of a concern. You must maintain basic hygiene at home. Simple hand washing goes a long way. I would recommend that less and less number of people handle the baby, because that would prevent infection in the baby who's still very, very delicate, who's not immunized and is most susceptible to infections. A very common question asked to us is whether we could massage the baby, and there are very many myths about it. A gentle massage does not cause any harm, and a simple coconut oil or an olive oil can be used, but no instillation of oil is permitted in the nose or any other orifice. The person who massages also should be neat, clean, and should not carry any infection which they could transmit to the baby. No other applicants like kajal or besan or anything should be applied on the baby, because that can cause a lot of harm. Apart from breast milk, the baby should not be fed anything. No water, no honey, nothing else should be given orally to the baby, because it all increases the risk of infection. The mother's diet should be healthy. She can actually eat everything. She should have adequate calories. She should be nutritionally rich food, and there is no restriction that don't eat this or don't eat that. But if she notices that on a particular food that she may have consumed that the baby is rather uncomfortable, she could probably avoid that. She should take good naps herself, adequate calories, take her multivitamins and iron, which is normally prescribed to her. When should you take the baby to a doctor? If a newborn baby has fever, is lethargic, is crying so excessively that you really don't know what the cause is, or the child is just not feeding, or the child is very breathless or coughing incessantly. So these are 4 or 5 signs when you should take your newborn baby to a doctor. I hope I have helped you all to understand your baby better today, and this would probably take you a long way in taking care of your little one. Thank you.